I am a big believer in the need to follow science. This is why I believe so firmly in the need for harm reduction when it comes to tackling addiction as a socio-psychological phenomena in our societies. However, while the science and research in this field are abundantly clear, the policy in many member states across the European Union, and in reality in most other countries across the world, does not seem to adhere to what researchers, scientists, and social psychologists have been telling us for all so long, that harm reduction is the only way forward when it comes to combating addiction in a dignified manner, which also adheres to the human rights of the person involved. Harm reduction policies are grounded in justice and human rights. The war on drugs has failed. For the longest time, we have been having the wrong conversation with the wrong people and in the wrong setting. But finally, I feel that, thanks to people like all of you present here today, this is changing slowly. Slowly, more and more governments are moving away from these aggressive policies around addiction and are adopting a more human rights-based approach to the conversation revolving addiction. Harm reduction is now arriving at the forefront of our policies, and we must all be ready to embrace this change our society so desperately needs. We must lead our debate on evidence, which focuses on harm reduction and best practice, which must include an open and honest discussion, not only with young people, but also older users too, about drugs and drug use, and a legal framework which leaves no one behind. But as a politician who sits firmly and proudly on the left, I am a big believer in listening to the people who are affected the most by the policies we as decision makers make.
And I can say, coming from the academic field, it often builds evidence, is built within scientific evidence, is built within the scientific community only, without meaningfully involving the practical level. And then we end up having a top-down approach that works to what works in drug policy. And when we try to apply this into practice, sometimes we end up with regulations or programs that seem to have fallen from the sky, and people on the ground don't really know what to do with it because it doesn't connect to the needs and the conditions at a specific location or with particular resources of that location, the political context of that place, and the specific subgroups of people who use drugs that these people assist and their needs. So to close this gap, what we advocate for is for the meaningful involvement of communities and civil society in the production of evidence and decision-making mechanisms of drug policy. So evidence must be built for, with, and by the community.
So we have different authorities responsible for different areas of drug policy. For example, one area is the responsibility of ministries of justice. Another area is the responsibility of the Ministry of Health. And on the ground, on the level of services, this fragmentation also results in frequent conflicts or contradictions between these sub-areas. For example, between law enforcement and public health organizations or harm reduction organizations. In practice, what that means also, similarly to the stigma and discrimination, if there are police forces around harm reduction services and people who use drugs know that if they want to go there, exchange their needles or syringes, and they can be arrested, they will not use the services. And also, I think that it's very important that we need to remember, and also Dr. Rigoni mentioned that already, that evidence is not only produced in academia. So I am also a researcher, but I strongly believe that that there are many other sources of evidence. For example, the best practice evidence, we need to consider the solutions that are already developed, adjust them to our local realities and try to implement them since they worked in different contexts. But also extremely important, the expertise of people who deliver different services and the lived experience of people who use drugs, it needs also to be considered as evidence. And this is related also to the need of including people who use drugs in the research activities. There are new paradigms in the research, like participatory action research, for example, when the affected communities are involved from the very beginning of the process.
And in my work in Parliament, I'm currently meeting with a number of other members who are of the same opinion in order to start founding a group between a number of us in order to start speaking on these issues even more firmly within the European Parliament. Obviously, to do that, we would need the help and the collaboration of organizations outside of the European Parliament that work incessantly on these issues from both a scientific perspective and a human rights perspective. So I think that together we can work together to find ways and means to continue growing this push that we're having in order to grow it into a movement of people that believe the same thing and to be effective.
Using substances, addictive substances, are not different kind of world. It's not that we don't use tobacco on planet Mars and alcohol on planet Venus or anything like that. It's all connected, especially with a young age. And as you mentioned, the research points out that the initiating drugs, we don't talk about gateway drugs, but initiating drugs are actually tobacco and alcohol, and people who use on regular basis alcohol and tobacco under the age of 15 are 8 times more likely to develop problem drug use, even on illegal drugs. So these things are not dividable. And
the second one about the participation of local agents, not only municipalities. I said before, civil society organizations, small civil society organizations. I think that we need in the policy making about illegal drugs, and not only about illegal drugs, also about legal drugs and other kind of problems related with the people. I think that we need more proactive methodologies. I think that we need to involve more agents, stakeholders, different stakeholders, policymakers, people that are intervention, people in the organizations, people in the administration, people in the field. For sure, the person that may have the problem, and we need to involve them in participatory action. When I need, in our opinion, is important. For example, we made an experience about the research about the regulation, the consequences of the regulation of cannabis, recreational and therapeutic use of cannabis.